Hi, I'm back with another session here. Here we will discuss about another important question, which is the WHO cervical cancer 2030. Cervical cancer is the fourth most common cancer among the women globally, and it is caused primarily by persistent infection with high risk type of human papilloma virus. It is a preventable and a treatable type of cancer, but still it is unavoidable. Because of that, government launched a program to control the cervical cancer cases and to control the death and mortality because of that. It is mainly occurring in the low and middle income countries. The disease affect women during their most productive years, which is the reproductive years, leading to significant social and economic consequences. So this program is structured around three key pillars. First is vaccination, second one screening, and third one treatment of the patient. So target vaccination targets are to 90% of the girls to be fully vaccinated with the HPV vaccine by the age of 15. And this is because the HPV vaccine can prevent the majority of the cervical cancer caused by HPV type 16 and 18. So, our approach will be implementing national HPV vaccination programs, making vaccines affordable and accessible for all, particularly in the low income countries, and increasing awareness about the cervical cancer. Screening target is 70% of the women screened using a high performance test at least twice. First screening should be by the age of 35 and the second by the age of 45. This is because early detection can prevent disease. Our approach will be introducing high performance screening tests like HPV DNA testing, training of healthcare workers, and reducing barriers like cost and access to screening facilities. Then one is treatment. Target is 90% women with precancerous lesions or invasive cervical cancer have access to appropriate treatment and palliative care. This is because effective treatment can significantly reduce mortality and improve quality of life. Our approach will be expanding access to surgery, radiotherapy, and chemotherapy for invasive cancers, ensuring access to pain management and palliative care for advanced cases. So, this is a global call to action, and the WHO strategy represents a collective global effort requiring collaboration among government, healthcare providers, NGO and community organization, international funding agencies, Gavi, and the Vaccine Alliance. So, implementation strategies will be the strategy emphasizes first on integration into the universal health coverage, embedding cervical cancer prevention and treatment in the national health plans, and mobilizing the international and local resources to fund programs. Now, health system strengthening. Training healthcare workers and strengthening laboratory and diagnostic capacities, building infrastructure for vaccination, screening, and treatment. Community engagement, addressing myths and misconception about HPV vaccination, encouraging regular screening and timely treatment, educating communities about cervical cancer prevention, research and innovation, developing cost effective diagnostic tools to prevent cervical cancer. As with every program, this program also having some challenges like lack of awareness and knowledge about cervical cancer, lack of access to information, high cost of screening, low risk perception, poorly equipped health facilities, poor health seeking behavior, lack of national cancer prevention policies and program. This is all about WHO 2030 cervical cancer program.